ನರ್ಸಿಂಗ್ ಕಾಲೇಜಿನ ರಾಷ್ಟ್ರೀಯ ರೆಫರೆನ್ಸ್ ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರದಲ್ಲಿ ಪ್ರಥಮ ತರಬೇತಿಗೆ ಚಾಲನೆ. ಬಾಗಲಕೋಟೆಯ ಬಿವಿವಿ ಸಂಘದ ಎಸ್ ನಿಜಲಿಂಗಪ್ಪ ಮೆಡಿಕಲ್ ಕಾಲೇಜಿನ ಆವರಣದಲ್ಲಿ ಸಜ್ಜಲ್ ನರ್ಸಿಂಗ್ ಕಾಲೇಜಿನ ರಾಷ್ಟ್ರೀಯ ರೆಫರೆನ್ಸ್ ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರದಲ್ಲಿ ಪ್ರಥಮ ತರಬೇತಿ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಚಾಲನೆ ನೀಡಲಾಯಿತು. ನವದೆಹಲಿಯ ಇಂಡಿಯನ್ ನರ್ಸಿಂಗ್ ಕೌನ್ಸಿಲಿಂಗ್ನ ಅಧ್ಯಕ್ಷ ಡಾಕ್ಟರ್ ಟಿ ದಿಲೀಪ್ ಕುಮಾರ್ ಅವರು ತರಬೇತಿ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಜ್ಯೋತಿ ಬೆಳಗಿಸುವ ಮೂಲಕ ಚಾಲನೆ ನೀಡಿ ಮಾತನಾಡಿದ ಅವರು, ವಿಶ್ವದಲ್ಲಿ ಅತಿ ಹೆಚ್ಚು ಪರಿಣಿತಿ ಶಿಕ್ಷಕರನ್ನು ರೂಪಿಸುತ್ತಿರುವ ಎರಡನೇ ದೇಶ ಭಾರತವಾಗಿದೆ. ಸಾರ್ವಜನಿಕರಲ್ಲಿ ಚಿಕಿತ್ಸೆ ಸಂಬಂಧಿತ ವೈದ್ಯಕೀಯ ಕ್ಷೇತ್ರ ಅರಿವು ಹೆಚ್ಚುತ್ತಿದೆ. ಈ ದಿಶೆಯಲ್ಲಿ ವೈದ್ಯಕೀಯ ಕ್ಷೇತ್ರದ ಬೆಳವಣಿಗೆ ಆಗಬೇಕು. ಶಿಕ್ಷಣ ಸಂಸ್ಥೆಯಾದ ಸಜ್ಜಲ್ ನರ್ಸಿಂಗ್ ಕಾಲೇಜಿನ ಅತ್ಯಾಧುನಿಕ ತರಬೇತಿ ಕೇಂದ್ರವನ್ನು ಸ್ಥಾಪಿಸಿದ ಡಾಕ್ಟರ್ ವೀರಣ್ಣ ಚರಂಪಟ್ ಅವರ ಕಾರ್ಯ ನಿಜಕ್ಕೂ ಅಭಿನಂದನಾರ್ಹ ಎಂದು ಶ್ಲಾಘಿಸಿದರು. ಸಮಾರಂಭದ ಇನ್ನೊರು ಅತಿಥಿಯಾಗಿ ಭಾರತೀಯ ನರ್ಸಿಂಗ್ ಮಂಡಳಿಯ ಮಾಜಿ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ಆಶಾ ಶರ್ಮಾ ಮಾತನಾಡಿ, ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರದಲ್ಲಿ ತರಬೇತಿಗೆ ಅಗತ್ಯವಾದ ಎಲ್ಲ ಸೌಲಭ್ಯಗಳನ್ನು ಒದಗಿಸಲಾಗಿದೆ. ಜೊತೆಗೆ ನರ್ಸಿಂಗ್ ವೃತ್ತಿಯಲ್ಲಿ ಪರಿಣಿತಿ ಹೊಂದಲು ತರಬೇತಿ ಪಡೆಯುವುದು ಅಗತ್ಯವಾಗಿದೆ ಎಂದರು. ವೇದಿಕೆಯಲ್ಲಿ ಬಾಗಲಕೋಟೆಯ ಲೋಕಸಭಾ ಸದಸ್ಯರಾದ ಪಿಸಿ ಗದ್ದಿಗೌಡ ಅವರು ಮಾತನಾಡಿ, ಶಿಕ್ಷಣದ ಬೆಳವಣಿಗೆಯಲ್ಲಿ ಬಿವಿ ಸಂಘದ ಕೊಡುಗೆ ಮಹತ್ವವಾಗಿದೆ ಹಾಗೂ ರಾಜ್ಯಸಭಾ ಸದಸ್ಯ ನಾರಾಯಣಸ್ವಾಮಿ ಬಾಂಡಿಗೆ ಮಾತನಾಡಿ, ಭಾರತದಲ್ಲಿಯೇ ಇದು ಎರಡನೇ ಸಿಮ್ಯುಲೇಷನ್ ಸೆಂಟರ್ ಎನ್ನುವುದು ಅಭಿನಂದನಾ ಸಂಗತಿ ಎಂದರು. ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ವಹಿಸಿದ ಬಿವಿ ಸಂಘದ ಕಾರ್ಯ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ವೀರಣ್ಣ ಚರಂಪಟ್ ಅವರು ಮಾತನಾಡಿ, ದೇಶದ ವಿವಿಧ ಆಸ್ಪತ್ರೆಗಳಲ್ಲಿ ಕಾರ್ಯನಿರ್ವಹಿಸುತ್ತಿರುವ ನರ್ಸಿಂಗ್ ವೃತ್ತಿಪರರು ಈ ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರದಲ್ಲಿ ತರಬೇತಿ ಹೊಂದಲು ಅವಕಾಶವಿದೆ. ಬಿವಿ ಸಂಘದಡಿ ಹಲವು ವೇದಿಕೆ ಸಂಸ್ಥೆಗಳನ್ನು ಸ್ಥಾಪಿಸಿ ವೈದ್ಯಕೀಯ ಕ್ಷೇತ್ರದ ಪ್ರಗತಿಗಾಗಿ ಶ್ರಮಿಸಲಾಗುತ್ತಿದೆ ಎಂದರು. ವೇದಿಕೆ ಮೇಲೆ ಸಂಘದ ಗೌರವ ಕಾರ್ಯದರ್ಶಿ ಮಹೇಶ್ ಯತ್ನಿ ಹಾಗೂ ವೈದ್ಯಕೀಯ ಕಾಲೇಜು ಆಡಳಿತ ಮಂಡಳಿಯ ಕಾರ್ಯಾಧ್ಯಕ್ಷರಾದ ಅಶೋಕ್ ಸಜ್ಜನ್ ಬೇವೂರ್ ಅವರು ಉಪಸ್ಥಿತರಿದ್ದರು.
In my 45 years of experience working in the government and in a regulatory body, I am yet to see a person like how he is committed for the improvement and development of the nursing sector. Because I worked in the Ministry of Health, I interacted with a lot of people were asking the funds for the strengthening of the nursing sector. I am yet to see a person like Dr. Viranaji. And he is so committed for the nursing profession. I think we need such people in India for strengthening the capacity of the nursing, which I was talking with Narayan Pandyaji with regard to, he was telling this is the one sector which is having a globally the need of the nurses is there. I am very much agree with him how important this nursing sector. And we are the largest human resource in the health sector. And with the 24/7 and 365 days. And I think during COVID, I think the globe has realized how important the role of the nurses and midwives in the healthcare delivery system. Many of the IAS officers I came across in Nirman Bhavan, many of the joint secretaries. So they were telling that Dilip Kumar ji, मेरा फैमिली में पूरा डॉक्टर से था, मेरा सिस्टर भी डॉक्टर था, मैं कोविड में एडमिट हुआ था हॉस्पिटल में, कोई भी आके नहीं देखा. My own brothers and sisters being doctors, whereas only I could survive with the nurses and they were with me, and that they were so. Of course, I think many people may say Dilip Kumar being a nurse is trump beating the nursing sector. I am not trump beating my nursing sector, but the reality is that we are the people available in 24/7, 365 days with the patients. And since I worked as a staff nurse, I realized, and we are the fortunate, I think the doctors and nurses, we are very fortunate to take this profession where the people who are in crisis, we are there to help them. Actually, many people may come and help you when you are good, when you are happy. But once you are in a crisis with pain and with sometimes I realize as a staff nurse, if you don't dress a patient, and that patient will not sleep. So if you give I have seen in my own eyes as a staff nurse when I did the dressing on that day between 2 to 4 when your whole ward will be quiet. And that patient next day used to tell me, brother, मेरे को अच्छा नींद आ गया. So that type of the blessings you cannot get with any amount of money. That blessing will, I think where I am now standing before you is, that is the blessing I could get. So we have selected as a nursing as one of the profession. We are fortunate. I think coming to the scenario of the nursing globally and the nurses in 2020, which the honorable the UK government took a decision to commemorate the May 12th, which happened to our birthday, and we Globe will celebrate as the International Nurses Day on May 12th. May 12th, if you ask many a times, with the due respect to the medical fraternity who are here, I can tell you.
Actually, nursing, where it's very difficult to convince people at the policy level for having any new things, established in your institute, in your university or campus, wherever you are. But I think you are very, very lucky that here all the dignitaries sitting here on the dais have given full support and have agreed to accept this concept of this simulation teaching. And because of that, I think it's not merely just agreeing or accepting the concept of the simulation teaching, but then making all the provisions for having that done. You see, the space, the money, finances that are included, involved, and people that you need for running the center. Although as teachers we all know simulation as a method of teaching, but we haven't been using it. And now we think simulation is what dummies you have in the fundamentals of nursing lab. You are doing simulation. It's not simulation, that is demonstration with some kind of a role play. But that's not simulation. So simulation is when you make use of the simulators, and there is a process involved in the simulation method of teaching. So I think it is not only enough for the policy level people to accept this method and make provisions for that, but also on the part of the teachers that you have to adapt now, right? Because so much of crores of money when you spend on these kind of arrangements, people have to use it. We have now 3 experts, from the SGT University where the first NRSC center was adapted, Dr. Anu Grover as the director of that center, Usha and Amanjit. And I'd just like to say one sentence about Madam Amanjit. The utilization of the simulation labs wherever there are, because there are many institutes in India in different states where they say they have a simulation lab, but actually it is not in the right spirit that they are making use of those simulators and the method of teaching. And so she has done that study. I'm sure she has submitted her synopsis, and soon we will have that report as to say how much, to what extent people are making use of these labs that are there. Once you spend so much of money and you appoint people to run these centers, then we should really make optimum use of these centers. We should not restrict to only our population, the state population, or only to your district or town, wherever it is there, or to only your institute. It must be, made available to other institutes. Not only in Karnataka, you can even, invite, let it be open to others for use. And uses like a PP model, public-private model, where you can charge some money for the institutes, the colleges or the schools of nursing to send their faculty for the training.
First training of trainers program on simulation-based education at the BVVS National Reference Simulation Center, Bagalkot, conducted through Indian Nursing Council, New Delhi. At the outset, I extend my warm and respectful greetings to our chief guest, inaugurator, Dr. P. Dilip Kumar sir, whose visionary leadership and outstanding contribution to the nursing profession has significantly shaped nursing education in India and beyond. We sincerely thank him for encouraging the establishment of this National Reference Simulation Center in Bagalkot, BVV Sangha. I respectfully acknowledge the presence of Sri Pandyaji, Honorable Member of Rajya Sabha, Parliament, and his presence and encouragement. Today is an important day for BVV Sangha. BVVS Sangha has established with the aim of serving society through education. Over the years, it has worked sincerely to train skilled and responsible professionals, especially in the field of health sciences. The training of trainers program starting today is very important. This program will help teachers to learn how to use simulation effectively in teaching. Through this simulation-based education can reach many institutions across the country. I believe this program will benefit all participants who have come for different states of India. Your presence shows your interest in learning and improving healthcare education. I am sure this program will be useful and meaningful for all of you. On behalf of Sangha, I assure you that we have made all arrangements for your comfortable stay. We hope you will enjoy your time in Bagalkot. Sangha remains committed to quality education and service to society. I wish the training of trainers programming and a grand success. Thank you one and all.
ಮೊಬೈಲ್ ತೆಗೀರಿ
ನೋಡಿ
ಹಾಕಿಂದು ಎಲ್ಲಿ ಎಲ್ಲಿ ಹಾಕಿ ಏನು ಬರ್ಬೇಕಾ ಸರ್ ಇಲ್ಲಿ ಸರ್ ಇಲ್ಲಿ ರೆಡಿ